Hi and welcome to another telehealth information video. I'm Garvin and this video is on Zemplar. So Zemplar capsules and injection contain the active ingredient paricalcitol, which is a type of a medicine called a vitamin D analogue. It is used to treat overactivity of the parathyroid glands in people with chronic kidney failure. So how does Zemplar work? Zemplar capsules and injection, as I said, contain the active ingredient, a vitamin D analogue, paricalcitol. So it's used to treat the overactivity of parathyroid glands in people with chronic kidney failure. The parathyroid glands are found on the side of and behind the thyroid gland in the neck. These glands produce parathyroid hormone, which is involved in the metabolism of calcium and phosphorus in the body. Parathyroid hormone is produced in response to low levels of calcium in the blood. It causes calcium to be reabsorbed from the bone in order to increase the level in the blood. In chronic kidney failure, the parathyroid glands can become overactive. This is because in kidney failure, the level of calcium in the blood can fall very low. So the level of calcium in the blood is closely related to the activity of vitamin D in the bone. So the kidneys normally convert vitamin D into an active form called calcitriol, and this helps control the absorption of calcium from the gut and its turnover in bone. However, in chronic kidney failure, the kidneys are less effective at converting vitamin D into calcitriol. As a result, less calcium is absorbed from the gut, which causes the level of calcium in the blood to drop. The parathyroid glands produce more parathyroid hormone in response to this, causing more calcium to be reabsorbed from the bone. This can weaken the bone and result in a condition called renal osteodystrophy. So Zemplar is a synthetic form of calcitriol. It works by binding to two specific receptors on the parathyroid gland, known as vitamin D receptors and calcium sensing receptors. By binding to these two receptors, Zemplar reduces the production and release of parathyroid hormone from the parathyroid glands. This helps to control levels of calcium and phosphate in the body and plays an important part in the regulation of bone mineralization in people with chronic kidney failure. Zemplar is only used in people with chronic renal failure who are on dialysis. The medicine is not removed by dialysis. So it's used with caution in elderly people, people with severely decreased liver function, people taking digoxin. And Zemplar should not be used in people with high levels of calcium in the blood, which is hypercalcemia, and people with too much vitamin D in the body, so vitamin D toxicity. And Zemplar should not be used, obviously, if you're allergic to one or any of its ingredients. So if this is the case, tell your doctor or pharmacist that you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using the medicine and tell your doctor or pharmacist immediately. So during pregnancy and breastfeeding, the recommendations, the safety of this medicine for use during pregnancy has not been established. However, there is potential that it could be harmful to a developing baby. It should not be used during pregnancy unless considered essential by your doctor. Again, speak to your doctor if this relates to you. It is not known if Zemplar passes into breast milk. However, if it does, it could cause a level of calcium in the nursing infant's blood to rise too high. So it should not be used by breastfeeding mothers. And if it is, only if the benefits to the mother outweigh the risks to the baby. So again, you get advice from your doctor before using breastfeeding. If used in pregnancy or breastfeeding, it should also be taken into account that this medicine contains small amounts of alcohol. So the side effects of Zemplar would be rash or itching, a high or low blood calcium level, high blood phosphate content, and underactivity of the parathyroid glands, taste changes and headache. And also side effects that could occur would be dizziness, disturbances of the gut such as diarrhea, constipation, nausea, vomiting, abdominal pain, dry mouth and rectal bleeding. Also low red blood cell count, which is anemia, and decrease in the number of white blood cells in the blood, and an increase in bleeding time. Also, some rarer side effects would be abnormal heartbeats, swollen ankles, which is peripheral edema, and decreased appetite and weight loss, agitation, nervousness and confusion. Also, rare side effects would be change in sensation and difficulty sleeping, and shortness of breath and pain in muscles or joints. So the side effects I've mentioned may not include all the side effects reported by the manufacturer. For more information about any other possible risks associated with this medicine, you need to read the information leaflet provided or speak to your doctor or pharmacist. So how can Zemplar affect other medicines? Zemplar can cause the blood level of calcium to increase in people taking digoxin. This can lead to increased risk of digoxin-related side effects. There may be an increased chance of the level of calcium in your blood rising too high if you take the following medicines in combination with Zemplar. So these are calcium-containing preparations such as antacids, calcium supplements or calcium-based phosphate binders, and phosphate-containing preparations, and thiazide diuretics such as bendrofluozide or Centil. Also, vitamin D supplements should not be taken with this medicine. If you are taking a calcium-based phosphate binder in combination with Zemplar, your doctor may need to reduce your dose if the level of calcium in your blood rises too high. So antacids or phosphate binders containing aluminium or magnesium should not be taken in combination with Zemplar, as these may lead to increased blood levels of aluminium or magnesium. And ketoconazole or nizoral is an antifungal medicine, and this can decrease the breakdown of Zemplar in the body, as this may increase the amount of Zemplar in your blood. Your doctor may want to perform extra blood tests if you're taking ketoconazole with Zemplar. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or you can ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.